To introduce myself, I'm a PhD student at the University of South Carolina School of Medicine, and I study immunology, and my research focus is acute lung injury and acute respiratory distress syndrome. So both acute lung injury and acute respiratory distress syndrome are pulmonary diseases, which can cause collapse of the alveolar sacs and also pulmonary hypertension. So what leads to this? Basically, you have inflammation of the lungs, which ultimately cause disruption to the epithelial and endothelial barriers of the lungs. So how do the coronavirus link back to acute lung injury and also acute respiratory distress syndrome? The coronavirus, it affects the respiratory system, which eventually develops into acute respiratory distress syndrome. So in this video, I want to talk about the pathology behind it and also talk about how diet may affect the disease outcome. So first, you must understand the purpose of the lungs. The purpose of the lungs is to exchange gas. So you want to take an O2 from the atmosphere and then you want to release CO2. So that's the main purpose of the lungs. When you disrupt this purpose, you can starve the cells of oxygen, which can make the cells go through hypoxia and eventually leads to cell death, and you can have multiple organ failures. The pathology behind it: when the coronavirus enters your body, it targets the respiratory system. So in the respiratory system, you have your epithelial cells and also your endothelial cells. Once the coronavirus attached to the cells and releases its RNA and DNA inside of the cells, your cells then release DAMPs, which are an acronym for damage associated molecular patterns. And these DAMPs activates your immune system. So you have your dendritic cells, your macrophages, your neutrophils. Your dendritic cells are going to activate your other immune cells, your T cells, but that's not important right now. What's important are your macrophages, and your macrophage stimulation. They start to release different kind of proteins that's turned chemokines and also cytokines. This recruits the neutrophils. Your neutrophils is what cause most of the damage to your lungs, which would then lead to your lungs replacing the epithelial cells and the endothelial cells with fibrotic cells. With the thing about fibrotic cells, they're stiff. They're not like the epithelial or the endothelial cells that can bend, can twist. The fibrotic cells are stiff. So when you think about breathing in and out, you can't really breathe. So you're not taking in that much oxygen. When you're not taking in that much oxygen, you're leading your cells to hypoxia. When you induce hypoxia, you start to cause cellular death, which can lead to organ failures and multiple organ failures, which can ultimately cause death. So how can we stop this? How can we stop the cellular death? How can we stop the disruption of the epithelial cells and the endothelial cells of the lungs? And how we can do this is by taking in green leafy vegetables. What's important about green leafy vegetables? They have multiple vitamins, and also they got other compounds that's very beneficial to the human body. So it's one compound I want to focus on right now. It's I3C, which stands for endo-3-carbinol. I3C can be found in green leafy vegetables such as spinach, kale, and broccoli. These vitamins and other compounds directly target the immune system and also can directly target the proliferation and the regeneration of epithelial and endothelial cells. So I3C binds to these infected epithelial and endothelial cells and tell them to stop going through hypoxia, stop stressing. It helps them clear out the pathogen, and also I3C binds to these Th22 cells, which produces IL-22. IL-22 then targets the epithelial cells and endothelial cells, telling them to regenerate and grow back stronger, which stops the progression to acute respiratory distress syndrome and acute lung injury. And this is what ultimately leads to amelioration of the disease. Lastly, I'm not saying that green leafy vegetables and I3C prevents the coronavirus, and I'm not guaranteeing that by intaking green leafy vegetables or increasing your I3C intake that it alleviates the coronavirus or it ameliorates the acute respiratory distress syndrome. What I'm stating is how that by taking in these green leafy vegetables and eating a healthy diet, it may lead to recovering from the coronavirus or any other virus in that matter.